Okay, so first, today we're going to discuss HIV in details. If you have any question, please feel free to interrupt me because I want anyone to be like confident about how to perform any HIV related stations. So please feel free to interrupt, feel free to say your opinion if it's against mine. I'm very open to anyone. I want you, all of you, to learn to your maximum ability, inshallah. So we just now discussed needle stick injury from a patient with HIV, and sorry, yes, I'm admitting people. So sorry, stay muted, please. So, like, as an station, we will do exactly same introduction, like introducing ourselves, confirming patient ID, and confirming the agenda of the meetings, and asking for expectations. And in this case, we know the patient, she's a nurse, so we need to like the introduction is going to be different, like more informal, and say hello, Miss Sarah, for example. Good to see you. How are you doing? And you can say like. The cause of the meeting and ask for permissions because it depends on what written for you. They so you have been asked to discuss this issue with her, so already you know the issue. You know that she got needle injury, and just you need to tell her. So now I need to discuss with you regarding the incident you recently had, if that's okay by you. And can you please tell me what happened in details? She will tell you the story when you say in detail, so it makes you like will save you sometimes. She will tell you like I washed my hand, I squeezed it, I washed it with the soap. So she might give you more informations from the start to save you sometimes instead of going back and forth in the questions.
Progression, dealing with what happened in terms of
Sorry, please, can you
sequence.
stay muted for me? And so then, like I ask, can you tell me what happened in details? And sorry, just unfortunately, I didn't do the setting for automatically coming to the room, so I'm getting distraction by admitting people. So, as you said, like what happened, and did you squeeze your hand? Did you wash it? As Samah said excellently, she told her. And did you use alcohol after it? And then we'll ask about immunization status, especially hepatitis B. Uh, she will tell you like I'm fully immunized, and she knows even like her immunoglobulin levels like normally should be checked, ideal for all healthcare professionals. And then you'll ask her like about her expectation and concerns. So she will be like concerned about HIV. She already like nurses, especially in this country, they highly educated. They know everything. Even you don't need to tell a lot. She knows exactly same information as you know. It's just like mainly about reassurance and about showing the examiners that I'm doing this. And because the examiners, they have tick list to tick it for you. So please don't give too much information in one tick. For example, like if you want to talk about the risk of encountering the infections, or if you want to talk about anything, try to be precise and short. So this is like, especially for the Irish people, to give you some times to finish all the required from you to pass these stations, and to give you some time to show more sympathy and empathy, and to give you more time to check understanding, and to give you more times to give them some time to absorb the informations. Communication skills, it can't go fast at all. There is no excuse, even if your time limit is short, it can't go fast. It's just makes you not good communicator, because the point about this, it's just to understand the feeling of the others and to react to their feelings. So it can't be so fast. So try to, as I said, get it fast by making them say a lot, and by asking them, do you know, whatever the station is. So they will already be knowing what is it. Do you know HIV, for example, or do you know what the risk of needle injury? Do you know what the next step to be done in your case? When you ask this question, if she said it for you, it makes your life easy, and it makes the station run faster. But if she didn't say it, you have to say it. But the examiner, he has a tick list, and he's following you like step by step to say everything. So the risk of needle stick injury, the most important thing, we have HIV, hepatitis C, hepatitis B. So this is all need to be addressed, and the patient concern regarding this needs to be addressed. And they said we need to reassure her the chance of getting these infections is really very low. Like the highest one is for hepatitis B, but they didn't tell you the patient had hepatitis B. They told you the patient has HIV. So HIV is the least one, which is 0.3%. And as Samah said, we need to write incident report forms and give her prophylaxis treatment for HIV, because the patient known to have HIV. And then we will repeat the test. We'll do baseline test for her, including hepatitis B, hepatitis C, serology, and HIV at baseline and after 3 months. Because even HIV can be negative initially and can take 3 months to appear in the blood, so antibodies. So we need to repeat the blood test in 3 months. And the most important things, HIV test need to be consented. Like the patient need to consent for it. In the past, used to be written consent. Nowadays, they just make it verbal consent. But it really needs to show the examiner that I'm taking consent. This is one of the biggest things they will deduct your mark if you mention it. So you have to tell the patient, is it okay to test you for HIV? And she has to say yes before you proceeding. So it has to be, if she refused, it has rights to refuse, but it will be another issue if she refuses. The station busway will totally change, because now we need to convince her. This is not just for her, for the patient safety, because she normally use like needles, and now she has this needle stick, so if she take blood from the patients, so will put the other patient at risk. So it's really encourage her to be tested. But there is no force. We should never fight. And even she said no, like give her time to 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 think about testing. And it's all about like your skills about how to convince someone to do the things. Like for anyone who refusing treatment, refusing to be tested for HIV, for example, if you convince them, they will accept, and you will pass the station. Even your life wouldn't be difficult if you have the right skills. That's why I always telling you, just try to work in your skills. Please don't learn the steps by heart and just go to the exam like this. No, try to work in your skills, how to convince, and it's all written in Arruh. You will find lots of good sentences. In my old videos, I will try to give you strong sentences. I try to like touch in everything, and I will do more just for you. But it's just try to be flexible in your language. Try to convince, and if your patient is convinced, you will get high mark, and your life will be easy. But if you just couldn't do anything, the station will be very complicated, and you will be surprised why I followed everything but I failed. I don't know. Many people telling me is I was doing all the steps but I failed. No, you failed because you wasn't using your skills. You was just following steps randomly, like you are reading a book, it will never get you anywhere. So as I said, we need to convince her if she refused, and we need to tell her, for example, if you turn out to be HIV positive, there is lots of effective treatment available, and the sooner we discover you, the more effective the treatment will be. And this is one of the things we need to convince with. And the other thing we need to convince with is, sorry, I'm admitting. So the other thing we need to convince with is اللهم صل على سيدنا محمد, patient safety. This is like legal obligation for her. It's not something like she need to choose here. If she refuses, she must do HIV testing for other patient safety. And this is legal obligations, and you need to remind her by this if she refused. But you are not going to break confidentiality at these levels, because you need to give her time to think, and you need to make effort to convince her. Like, it should be the last resort is to break confidentiality. It shouldn't be like something you opt to ask fast. You have to take your time. You have to give even like normal patient, you have to give them another time to think, arrange another meeting to convince them. Don't rush in breaking confidentiality, even if it has public safety. You can arrange another urgent meeting to discuss it further, to try to convince them and get senior involved as well. And just like as I mentioned, these stations are like just general advice. Like, you can tell her like to avoid blood transfusions, avoid sharing personal instrument like shavers or razors, brushes, and use safe sex. And it depends on the stations, and they will bring it for you in too many different versions. So don't rely in only one. Don't be like reassured that it's going to have the same stations. It may sound the task from outside the same, but how they will direct the station for you, it will be totally different. So be prepared, as I always tell you, be prepared to go with the patient. Don't be don't come with your own list to follow. It's just going to make you fail, while you are already very good. You have good skills, but because you are occupied by something, this make you lose your stations. And even it happens also in the long station. Like, sometimes you may think the station this way and turn out to be something else, and just you find yourself lost your time looking for certain differential, while the station totally changed. They don't want you to even find diagnosis. The patient concern is about like complications or something else, or insurance or whatever. So you have to learn from the patients how to go and which the pathway to take. Do you have any questions?
Dr. Afaq, it's wonderful session as usual.
Thank you so
I would
much.
like Thank you. I would like to ask you about like if the patient is nurse, same like this station. So still we should avoid like medical term, or it can be accepted as she is nurse and she will understand most of the word.
That's why I'm saying, like, I would ask her, like, how much do you know about needle stick and what is step to be done? If she use medical term, I will use her own words. But if she use simple word, I will use simple. But overall, just to be cautious, because we don't know the mentality of the examiners, and some examiners just take it as just very, very stiff. Like, it depends on the personality also. So I will try to avoid medical jargon. But even if the patients or the nurse, if they mention it themselves, it make my life easy. I will use their own words. It wouldn't be a problem, because if they don't know it, they wouldn't say it in medical jargon. But she might just tell you the medical term herself. And when you ask her, like, what do you know about needle sticks, and how should we deal with it? Do you have an idea? She may tell you anything, and she turn out to know anything, and she tell you even the medical jargons and use it with it. But I will try to avoid. If I have no idea about her levels, it's better to avoid, even if it's a doctor's with me. It's better just to avoid it, in case of the examiner, like is like retiring soon, and just he has his thick jargon, he forgot even this is doctors, and just penalizing you for this. So just I will be in the safe side, and try to use as simple language as possible. And sometimes as doctors, what comes to your head first is the medical jargon. So I would normally say the medical jargon and explain it straight away, fast, before the patient interrupt me. Because if the patient interrupt me, I tell you, what do you mean, doctors? It will appear like you said it medical jargon. So I say it, and it's fast. I will explain what I mean by that, and just I try to explain what this medical terms. Yeah. Any other question?
Sorry, I have other question.
Yes,
Regarding
please.
the job, Dr. Afaq, if the patient, as like Dr. Samah answered her question regarding the job, so it can be like something in general, like we can advise her, like you can work as a medical officer, for example, but we cannot promise that we are going to like change the your job from nurse to other job in the hospital. I mean, it's not going to be our job, or it's not going to be like guaranteed, but it's like what is going to happen in general. Is that right?
Yeah. Yeah. So the first thing, good question. So the first thing is is like we have to involve the occupational health. So the occupational health, they will decide according to her virus levels. They will do follow up on her blood and see her virus status, and they will decide where she can cover, like, and where area it's safe. So occupational, any hospital has occupational health department inside the hospital. They will decide for her. But if she concerned about it, just we'll tell her the general rules. If your HIV is positive, you will be advised to avoid any direct contact with patients, and they may allocate you to other job which doesn't have direct contact with patients. Even I wouldn't talk a lot about it because it's not our job, as you said, and this
Yeah.
is occupational health department job. So, and there is no time even to get to into this way. I will tell in general, just to avoid direct contact with patients and occupational health, they are better to advise you in this regard.
Yes, that's exactly what I mean. Thank you so much.
You're welcome. Any other questions?
Hello, Dr. Afaq. Thank you very much for this great session. I just wonder, is it mandatory to inform her husband um, with regard to this, what's going on, or we just give her the precautions, or how we convince her to do if it's mandatory to inform her husband?
So the first thing we will advise is like to avoid any unprotected sex. This is the first thing. The second thing, we will tell her if your test turn out to be positive, it's your right, it's your husband's right to know about this, because the sooner he get treated, it will be more effective, and he also will not give you the infection back. So we will, as I said, our aim is to convince her. In this station specifically, is she's not positive yet, so she is not obliged to tell her husband yet, but we will give advice regarding safe sex. But after the test is positive, now they should tell their partner, and all of them, even they have too many, they need to be informed. So there is a partner anonymous notification program. Normally in the UK, they will tell the patient that just send random letters. They tell them one of the partner you have sex with during the past 6 months, he turned out to be HIV positive. Please come to the GUM clinic to be tested for HIV. So even if they don't want to speak directly to them, they can have this party notification program. But the thing is, as I said, and because this is communication skill stations, we have to convince them. We have to convince them why it's really important to tell their partner about the fact that they are HIV positive, and it's just to protect the partner and to protect themselves as well. And also, like, if she said okay, that's fine. If she said not okay, we always scare as well. We talk about the legal. So we said it's legal. It's a legal offensive if someone intentionally transmitted HIV for someone else without their knowledge. So I always tell her this is like legal offense. She can be penalized for that if she refused. So we'll try everything. We'll try to convince her kindly, and then we can scare her a little bit. And as I said, arrange her another meeting to convince her and involve consultant. But the end of it will be like a breaking confidentiality if they insisted at all. But normally they wouldn't, because they know we're going to do it against them at some point. So it's better to come from them. It could be like easier, like to And also you can tell her, if you feel like hard for you to discuss it with your husband, we can invite you together to the clinic to help you disclose the information to him. So try different ways to convince rather than breaking confidentiality, and don't rush for it. Because even like you will have, if you do it this way in your exam, you will have very bad relation with your patient, and you know the patients, they play mark in your marking. They play role in your marking, not just the examiner. When you leave the station, the examiners will ask the patient, how did you feel about these doctors? So always believe them, always make them feel happy, and just take it gradually. Try to convince them gradually. Try to convince them because you're really concerned about their health. Because if they didn't tell their partner, the infection will be coming back to them again. They will never get treated. And HIV, if it's not treating, can have serious complications. I'm really concerned about you. I need to get you treated and your husband as soon as possible, and so you can live a near normal life and avoid any further complications. Make effort to convince. You will be fine. They will be convinced as well.
Okay, thank you very much. Thank you.
Welcome.
Dr. Afaq, can I ask if can I add like if you didn't do the test now, so you'll be not able to take the compensation in the future as a add point to convince her?
No. First, we wouldn't like because the patient's safety and her safety in medicine is more priority for us as doctors. So the financial issue comes in the end. So I wouldn't use it as to convince, because I have too many strong points medically to convince with, like safety, her management, her husband management, the patient safety, whatever. There is too many points I can take from there. And as I said, if she didn't take it, I will scare by the legal obligation. I will not touch into financial part.
Okay, thank you.
Yes.
You speak about plan of management. I don't hear. I don't know what you will tell her. You need to give antiviral and this.
Yes. So in terms of needle stick injury, she needs to have antiretroviral for 3 months. If the patient HIV positive, so the nurse need to receive HIV virus. It's 3 medications combinations, and she will have it for 3 months.
No, I mean before result. You will tell her we need to
Yeah,
start.
it's prophylaxis. It's prophylaxis with before result. Straight away, right now, she will have it. After result, this is something else. She will be treated as HIV patient normally. But before result prophylaxis, she will take HIV treatment for 3 months. It's prophylaxis.
Okay.
Just the fact that the patient is HIV positive, she had a high chance to get it herself. So it's better to receive prophylaxis. It will cure any tiny virus if she had it.
Hello, doctor.
Yes.
Yes, doctor. Should you raise the issue of hepatitis B and vaccination in this case, or if necessary in this case? The issue of hepatitis B and the vaccination and immunization.
Yeah. So we speak about like ask her, may I know what is your vaccination status and hepatitis, especially hepatitis B, immunoglobulin levels status. So she will also be checked for her immunoglobulin levels, and she will know if she's adequately immune against hepatitis B or not. But as I said, the most important thing, and not in this station, in all the stations, if you don't know or is stuck, always make sure you involve the right specialty to help you. For example, driving. You don't know how many months should be stopped from driving. Just mention about DVLA, they will take care of it. You will not be penalized at all if you didn't mention about the number of months you stop driving. And for this one, if you mention about occupational health, and infection control, because the infection control or the like what is it, microbiologist in the hospital, normally they will take care of about everything, treatment, anything, job, occupational health will take care of the jobs. As far as you involve the specialties, you will be fine, especially with the time management. Just mention these words No problem at all. Like you don't need to answer all questions. You don't need to know all the questions. Just you need to know to involve the right specialties. And in this country, no one will interfere in other one specialty. Like just you refer to the right person, your job is done. Any other questions? So someone asking when we will repeat the test in 3 months. HIV can be negative initially, and it takes 3 months to appear in the blood. That's why we repeat in 3 months to make sure she's HIV negative. If the first one is negative, we need to repeat in 3 months. Any other questions? Any other question, please? So like if like the station, it can come as breaking bad news HIV. The patient did the test and came now for the results, and he's HIV positive. So in this case, as we discussed in breaking bad news, you have to break it gradually, and you have to take it from the patient. As I mentioned before in the breaking bad news station, I said like you need to make them say it for you. Like, did you give it any thought? What the result could be? So if they said like, could it be positive, blah blah blah. So you will prepare them when you ask them about their expectation about the result. So it's really good for HIV. It's breaking bad news, but we don't invite for someone to be present because of the reason of confidentiality. You can invite them. Do you want someone to be present after you telling them the bad news? After you telling them you are HIV positive, after that you can ask them if you want someone to be present. They can decide or not because they knew that they HIV positive. But before breaking the results or telling them about the result, you shouldn't invite for someone to be present for confidentiality reasons. And always ask the patient if you want to explain disease. For example, just I'm talking about this station about results. So do you know before you explain the disease, do you know what what do you know about HIV? For example, um, if the disease is very strange, like is uncommon, you can say, do you have an idea about this disease? But if the disease, for example, HIV, anyone know HIV, but you can ask him, what do you know, or how much do you know about HIV? So, like he will tell you it's a serious disease, killing disease, whatever, and you correct the information they have. And in this station, like as we said, for example, if you need to disclose about results, HIV results, so we need to ask some questions about HIV risk factors, including the sexual history in details. And we're going to tell them in the management part, you need to inform all the partner you have sex with within the last 6 months to be tested for HIV as well. And advice about practicing safe sex. Any other question? So thank you so much for joining, and see you another time.